To help us discuss tips on healthcare benefits and some interesting options for business owners is expert Dr. David Emery. Dr. Emery opened his practice in 1968. In 1978, he changed over to occupational medicine, working with industry on issues such as the prevention of illness, disability, and cost management. Since selling his business to Emergis in 2001, Dr. Emery has become an angel investor and strategic and operational consultant to emerging informational-related businesses. What are some of the drawbacks to those traditional healthcare benefits that people would buy for their business and their employees?
Well, I think if you ask most employees about their health benefits, they refer to them as fringe benefits. Mm-hmm. And I think that says it all, David. Those health benefits are very good in the rare circumstances where people get very sick. But in everyday purchases, when they go and purchase eyeglasses or go to their dentist, these plans have been designed that they have to reach into their pocket and use after-tax dollars to get access to those benefits. They just aren't working very well for the average employee or the average business, and they're very expensive.
Some people are going to want to know, well, what is it I have to reach into my pocket for? Give us some examples of some of the dollars that people do have to come out of shell out of their pocket that they might not even think of or they don't even recognize.
Well, I had personal experience with this. My eyeglasses cost about $500. An insured benefit plan typically covers $150 to $200 every 2 years. So basically, a person would have to earn $500, $600, $700 of wage earnings to pay for the rest of the benefit, which the government allows them to write off tax-free if they can. Another example is an implant. Many people want to have dental implants. Very, very few plans cover that, and so they're reaching into their pockets to pay for a legitimate expense that can be written off tax-free but isn't covered in their plan.
Now there are some things like co-insurance and deductibles, and I guess all of those things play into it as well. Explain to us how some of those things work and why that's a disadvantage in taking money out of people's pockets.
Well, again, insured benefit plans typically for low-cost drugs or routine dentistry have a 20% copay. What that means is that the insurance plan will pay 80 cents on the dollar, and the person has to pay in after-tax dollars the other 20 cents. Now, everyone is grateful to have the 80 cents paid. But once you get into more costly items such as dental implants, braces, eyeglasses, many other services are not covered at all, or the co-pays are very significant, 50% or more.
I know that sometimes when employers are looking to cut back on some of the costs that are associated with health care benefits, they start to increase these co-pays. So instead of it being 80-20, it might go to 70-30, or they increase the deductibles from $25 to $50 to $100.
That's right, and this is a great concern for me. I'm a physician by training. I want to see people get the help they need. And the idea of controlling costs by making bigger holes in the Swiss cheese just doesn't seem to make sense when there's a better option. The important thing is that as people are aging, as our working population is aging, after 45, the costs of drugs and other benefits double. After 55, they double again. And so now we're moving into a demographic age group that are going to need more and more benefits than their insured plans provide. But basically, that's why I got interested in a registered health spending account because it's a much better option for people as they age.
Now, especially when it comes to chiropractic care and physiotherapy, where you might get $40 per treatment reimbursed, but a lot of it is capped with the number of treatments that you can go to. So if you're in an accident or you have a chronic illness and you need to go to a chiropractor on a regular basis, you burn through that amount fairly quickly. So you can see where this would be a great benefit.
Well, you mentioned earlier that health benefit plans are being holed out, that there's more and more copays and deductibles. And really what the trend is today is to cover drugs and to cover routine dental work. But chiropractic, physio, massage, many of the other features, eyeglasses, these things are being restricted with $250 a year or totally wiped out of the plans. And so this is really, this is a good time for people to be considering registered health spending account.